Live from the Twin Cities, this is the Fox 9 Morning News.
Plus, we'll talk with the Twin Cities doctor and patient about a new non-surgical treatment that's putting life back into people's knees.
All right,
First, knee pain. It is one problem that keeps millions of Americans from being active. But coming up a little later in this half hour, how technology is getting everyday people and professional athletes back in the game without surgery. We're going to talk with the Twin Cities doctor and one of his patients about the treatment. Well, millions of people suffer from osteoarthritis, with a third dealing with knee pain. But there's a new cutting-edge treatment doctors say can actually keep people from having surgery. This new treatment is called Bionicare. Joining us this morning, Twin Cities Dr. Nolan Siegel from Western Orthopedic Surgery and patient Janet Nyholm. Good morning to both of you.
Good morning.
Good morning.
Seems like everyone has knee pain, you know, and it seems like the first option always seems to be to get knee surgery. I mean, it's as common as anything anymore. How big of a problem would you say this is, Doctor?
Well, osteoarthritis in the knee is a huge problem currently, and projections are even greater. For instance, in 2005, there were 523,000 total knees done in a year. By 2030, that number is projected to be 3.5 million total knees per year.
Wow.
The people who suffer from arthritis, for instance, back in 1995, that number was 40 million people. By 2020, it's expected to be close to 60 million people who suffer from osteoarthritis.
Is there a reason for the high numbers, the extraordinary number of people?
There are a few things. First of all, in terms of demographics, there's a significant increase in the general age of the population. Also, there's an increase in trauma. I know that in generations past, there was much less emphasis on exercise and athletics. So my generation, I'm one of the baby boomers here,
right.
We're much more active athletically, so we're more prone.
That's some good news out of all of this.
We're more prone to injury, so that's a contributing factor. Another problem, which we've seen a lot of information about, is obesity.
Sure.
Especially, you know, and the heavier you are,
right,
the more likely you are.
Well, we don't want to run out of time here. Let's get to the product, because it's cool. You hear Bionicare, and I said to you, I can't help think of Bionic Woman, and you know, and that's kind of, I mean, it's new, it's different, and it's a great option when you don't want to have surgery.
Yes, it is.
Talk to me a little bit about how it works.
Well, the science behind this device is that the researchers found that the cartilage cells in the joint have an abnormal electrical charge. And they developed a system whereby they could put an electrical charge across the knee joint and help restore the normal electrical charge in the cartilage cells. What that does is, and they have found in numerous laboratory studies and in clinical studies, is that you can reduce people's pain, stiffness, and actually improve function in arthritic knees. So in an ideal situation, you can take someone, use this device, and they improve function, and we have a patient here who can vouch for that.
And Janet, you have it on both knees?
Both knees.
Tell me how this has impacted your life. How has it changed things for you?
I do a treadmill about an hour a day, and I was doing it at about a 6.5 grade and a 3.3 miles an hour. A year ago, I was at absolutely no grade and barely going at 3 miles an hour, gritting my teeth because of the pain.
What happened? Did you have osteoarthritis?
Yes, yes.
And it almost was debilitating, it sounds like.
It was. I was pulling myself upstairs. I was going downstairs one step at a time, and it was interfering with my everyday living. And since I've had these on, I just went up and down a flight of stairs yesterday. I went 5 times, no pain, nothing, no up and down. I'm back to 3.5 grade on my treadmill, and I'm working back up.
And is this something you just get up and put on every day, that kind of thing, or you actually sleep in it?
I wear it at night. I mean, what else do you do when you're sleeping?
Right, so you don't even start off with any pain. And doctor, you're here talking about this because really the first option for a lot of people is knee surgery, and you're just kind of trying to get the word out?
Yes, unfortunately, not enough people know about this device. This is a non-invasive technique with no downsides. There are no risks involved with this. It's not invasive. It reduces the amount of medication people take. So you're not going to burn holes in your stomach from taking handfuls of
pills and things.
It's not injections, and it's not surgery. I mean, there are a lot of treatments for the knee short of doing surgery, but this is a great alternative.
Real quick, does insurance typically cover this?
There is a Medicare billing code for this, so yes, it should be covered. There are some issues with some insurers, but we're working, and I work very hard on the patients that I prescribe this for to get coverage, and I will go through an appeal process if they deny. The cost of this is minimal compared to the cost of a knee replacement.
Right, so it could be the best way to go for a lot of reasons. All right, well, Dr. Nolan and Janet, thank you both for being here. We appreciate it. For more information on the treatment, you can go to Bionicare.com. And we'll be right back with